Assalamu alaikum, everyone. So my name is Zakaria. I'll be moderating the session. With us today, we have Dr. Humera. So Dr. Humera, I'll just give a brief introduction about her. So just give me 1 second. Can everyone hear us and see us? Please give us a thumbs up in your video if you're on board. All right, looks good. So Dr. Humera Mishal Khan attended Connect College for Women, Lahore from 2016 to 2020, where she got her bachelor's degree in applied psychology and developed a fortunate interest in psychology. She's experienced running group therapy and occupational therapy sessions with good feedback. So Dr. Humera will be presenting for the next half an hour on meaning in life among doctoral students. So handing it over to Dr. Humera.
Okay, Assalamu alaikum.
Assalamu alaikum, Dr. Humera. You have the floor to speak.
Yeah, sorry, I was just adjusting the slides. Okay. Assalamu alaikum, welcome, and thank you so much everyone for joining. Many of you might be joining from different time zones, so good morning, good afternoon, and good evening respectively. My name is Humera Mishal Khan, and I'm from Lahore, Pakistan. And the topic I'm going to present is meaning in life among doctoral students. And I did this research under the supervision of Dr. Ayesha Aziz. So life is meaningful, but its value lies on how we look towards it. A sense of meaning in life brings people joy for a greater well-being. People without a sense of meaning go about and search for it. Meaning in life is basically the understanding of whatever happens in our lives is due to a reason. It's a belief you're alive in order to do something. It's a sense that your life matters. Meaning in life is an essential part of well-being and comfort. It's a network of interactions, interpretations, and perceptions that we hold and help us understand our experiences. A person's need for meaning remains elevated. According to Baumeister and Landa, meaning in life incorporates 4 characteristics: intent, matter, consistency, and coherence. According to Maslow, meaning in life refers to a feeling of homogeneity and interaction. It refers to a positive consideration of life. When an individual achieves something in his life, it gives a suitable understanding of life. A stronger sense of meaning and purpose is connected to mental health benefits. There are many factors which affects fun meaning: social factors, cultural factors, perception a person holds about himself, about the world, and about the people around him, and suffering. Islamic view basically says that our utmost objective is to worship the Creator by abiding the divine guidelines. The verse says, "And I created not the jinn and mankind except that they should be obedient." The verse explains that the meaning of life for an individual is to know the nature of God, be obedient servants of God, to reveal that nature, to prove its value as the ultimate treasure. There have been different perspectives which explain the concept of meaning in life. The existential perspective focuses on more uncertain aspects of human life. It explains that hardships and sufferings help people understand meaning in a much, much better way. Dual system model explains 3 key issues: what people really want and how they achieve their goals, what people fear about and how they overcome those fears, how people make sense of life. Perspective and positive psychology focuses on the emotions, positive interactions, and human strengths. It basically states that psychological well-being is based on many aspects, including self-acceptance and meaning in life. Park's model of meaning explains that meaning is disrupted by hardships, but then is restored. It identifies 2 important stages: global and situational. There are people who look at events altogether, while there are people who took meaning from a single event. Many theories have defined the concept of meaning in life. Viktor Frankl's theory states that aim of life is not to pursue pleasure or strength, but rather meaning. We can find meaning by doing something creative or doing an act, experiencing something loving, or in their attitude towards suffering. Social learning theory, according to Bandura, social behavior promotes the development of new habits. A person may experience meaningful life through the rewards or punishments he receives in return for his work. Acceptance theory of motivation, according to Victor Vroom, motivation for any action that a person performs depends on the desirability of the outcome. People find meaning by their achievements and the work they do. Irvin Jaloom's theory focused on interaction, implying that a person finds something which concerns at the moment. Basically, it states that the more the person is involved in the work, the more they find meaning, because meaning is always a byproduct of involvement. Self-efficacy theory of motivation states that practically everybody can define goals and objectives. A strong sense of self-efficacy may take life in a more meaningful way as compared to the person with low self-efficacy. Literature review states that meaning in life complements the low levels of psychological stress. It indicates higher presence of meaning and search for meaning. It can be acquired at any place depending on the social group we belong to. Meaning may be a person having or experiencing meaning are satisfied with their life and vice versa. Studies also showed positive relation among spirituality and meaning in life. Meaning can be self-oriented by feeling fulfilled or other-oriented, that is by helping others. Meaning in life is linked with positive consequences. Women showed higher rating for life being as worthwhile. Result indicated a positive relation between experiencing meaning in life and satisfaction with life. The rationale with reference to theoretical background and literature review, the current study aimed at exploring Pakistani doctoral students' lived experiences to gain a deeper understanding of their significance of meaning in life. A lack of indigenous researches on the selected topic makes it essential to study the concept on the Pakistani population using qualitative research design. This will help us understand the factors that help to maintain academic, professional, career life, and how they are coping with stress and frustration. Moreover, this research is an essential contribution in the field of psychology and helps to design some quality intervention for this population. Objectives for this study is to investigate the perception and experiences of doctoral students regarding meaning in life. The research question was, what are the perceptions and experiences of doctoral students about meaning in life? Methodology. The qualitative research design is more suitable for the current study as the purpose was to explore the perceptions and experiences about the meaning in life among doctoral students. Phenomenological research design was used along with transcendental phenomenological approach to execute the study. Phenomenology is a process of inquiry that seeks to explain human experiences. Constructivism paradigm has been used because it focuses on how individuals make sense of their lives. There are a few assumptions. Every PhD student would have different perception and experiences, is highly influenced by internal or external state. Meanings can be either strengthened or weakened after traumatic events. Information from the PhD students will be derived by conducting in-depth interviews. All relevant information derived from interaction with participants will be quoted and published as it is. Distance between researcher and his subjects will be lessened. Meaning in life is a fundamental phenomenon. High level presence of meaning indicates low levels of psychological stress. Religious experience and meaning in life are positively related. Meaning can be found in any place. Sample and sampling strategy. Creswell suggested that in a phenomenological research tradition, the size of participants can be between 5 to 25. The selection of these participants should reflect and represent the homogeneity that exists among the participants. For the current study, a sample of 10 participants 3 males and 7 females enrolled in a PhD degree program has been selected through purposive sampling. Inclusion criteria were participants who are doing PhD degree program of 5 years, approved by Higher Education Commission in a government and private universities has been included. Participants from the following disciplines were chosen: political science, Islamic studies, clinical psychology, Urdu, and education. Both male and female participants who are either married or unmarried, employed or unemployed has been included. Participants who have passed their comprehensive ASRB and DTPC were included. Participants who have sent their work for peer review were excluded, and participants with Higher Education Commission funding scholarships were excluded. Data collection, the information related to the topic of meaning in life among doctoral students is gathered through biodata form, basic screening questionnaire, and semi-structured in-depth interviews. The biodata form was important to use to evaluate crucial demographic data, which includes age, gender, education, marital status, qualification, socioeconomic status, family system. Screening criteria questions were included in the research that helped to filter out or evaluate participants on the basis of the inclusion and exclusion criteria. Semi-structured in-depth interview was a helpful technique in order to explore phenomena and experiences of people. The interview guide was developed, which contained basic questions that were used to screen out participants on the basis of their demographic information, and some factual questions, which aimed to screen out basic factual information about participants. The interview guide included 5 main open-ended questions focused on central phenomena of interest being investigated in phenomenology. The reason for selecting few numbers of questions is to get, excuse me, sorry. The reason for selecting few numbers of questions is to get enriched and detailed information from participants. The duration of interview was 40 to 60 minutes, and as interview guide was in Urdu, before implementing on, it was checked by an expert, reviewed by it, and the changes that were told by the expert was incorporated. Procedure: pilot study. Pilot study is basically the smallest version of the study that is carried out before the actual study is done. For piloting of the study, one participant was selected in order to see respondents' understanding of the questions. Participant fulfilled the criteria. The interview took 40 to 45 minutes. The participant for piloting was a female aged 37 doing her PhD in political science on self-finance. The participant was asked to provide feedback. The participant appeared to have comprehended every aspect of interview guide in proper and accurate manner. Main study was conducted after the departmental and institutional approval. The participants were approached from different universities of Lahore. A total sample of 10 participants were taken from 6 different universities of Lahore on the basis of screening and inclusion criteria. A total of 17 people were approached, among only 10 fulfilled the criteria. 7 were not fulfilling the criteria or were not willing to participate in the study. Participants were informed about the purpose, duration, right to withdraw, privacy, and confidentiality, and participants were given consent form. The method that was used to analyze data was called Aziz's descriptive phenomenological data analysis, was diligently followed through a series of steps. This method basically was used in order to gain the in-depth experiences of doctoral students. It provides complete information about the personal experiences of the participants. It explores that how a given person in a given context makes sense of a given phenomena. Data was verified and peer-reviewed and externally reviewed for any required changes. The external review enhances unit of knowledge in order to sustain area of strength and work for improvement. The external team brings a new viewpoint. Ethical consideration to conduct research, departmental approval was taken, the institutional approval was taken, written informed consent was taken from the participants. All interviews were taken place in complete privacy. The research data was kept safe. Only the researcher and the supervisor had the access to it. Results. The main theme that emerged was actualized self, which was supported by hierarchy of need principle of Abraham Maslow. Actualized self is basically when you live your life purposefully and authentically and display compassion towards others. You are on the right track. The research also indicated 4 major themes: perception about self, religiosity and societal influence, educational experience, and experiential realization that were organized to represent perceptions and experiences of doctoral students regarding their meaning in life. And now the first major theme was perception about self. Almost all participants reported that their meaning was attached to the feeling of satisfaction by being a PhD scholar. Participants also stated that their meanings are attached to the extent of how focused they are towards their goals. Second, religiosity and societal influence. Participants stated that religion impacts their way of life by acting as a guiding tool. It helps them to be focused on their path. Whenever they felt lost, religion helped them find better ways of coping. Another thing they stated was that positive and motivational social circle influence their meaning and change the perception. Supportive family and friends have given them strength and motivation. Third theme was educational experience. Participants stated that the childhood educational experience and family background have given them provided them a step towards finding meaning in life. They also stated that education makes people differentiate between right and wrong, and helps them to move on the right path. The fourth is experiential realization. Participants stated that traumatic life experiences enhance their growth prospects. They also stated that the more meaningful their life was more meaningful when they had an responsibility to perform. Also, human beings are unique creatures with the ability and need for meaning. During transitional times, people are tended to feel meaningless, such as during the initial times of COVID-19, everyone was in a sense of dismay and seemed to feel empty because everyone was staying at home. These times make people feel low. Comparably, a meaningful life is not inherently happy life. A meaningful work, positive relationships, and experiencing one's life in a positive way. Conclusion: gain in-depth understanding of the experiences and perceptions of doctoral students regarding their meaning in life. The main theme, self-actualization, showed a strong inclination towards perception about self, experiential realization, educational experience, religiosity, and societal influence. With current dynamics and the influence of social change, the present study revealed that Pakistan is transforming as a society as it is for educated masses, as they preferred education being important too. The study also showed that implying religious teachings in life have an everlasting impact in creating a meaningful and purposeful life. The most important aspect found in the study was impact of traumatic life experiences and supportive social circle in forming meaning in life. The strength of the study included The current study allowed the extraction of rich in-depth data that enabled us to not acknowledge the experiences of doctoral students regarding meaning in life, but also the perceptions related to it as well as elaborations for them. The study gained immense insight into the experiences and perceptions about doctoral students regarding meaning in life, which was hallmark of the study. Findings demonstrate the positive consequences of following religious teachings. Traumatic life experiences, education, and perception regarding self are beneficial for promoting a meaningful and purposeful life. Limitations. Meaning in life was studied among the doctoral students from social sciences discipline, which is why the results of this study cannot be applied to the population of other disciplines such as natural and applied sciences. Difficulty of accessing thoughts on life's meaning. Many of the participants noticed that it was not easy for them to express their thoughts. Recommendations. A similar study can be conducted on a large scale with more participants and more diversity in demographics to make a comparison in results, specifically across different classes and religion. A quantitative study can be conducted in order to provide quantified statistical data to understand meaning in life in an easier manner. A comparative study can be conducted among biological sciences and social sciences to provide a better comparable data. Observational study can be done on the sample to gain unbiased information. Implications. The result of this research can be utilized to understand the experiences and perception of doctoral students regarding meaning in life. Present research give light to further researches conducted on a broader spectrum. That's all from my side. Thank you.
Thank you so much, Dr. Humera. So you ended on time, which is great. There are questions for you, which we'll address in the discussant panel towards the end. Thank you so much for your presentation. I hope you stay online for our next segment for half an hour, followed by our discussion for half an hour. So we hope to see you shortly. Thank you.
Yeah. Thank you.
We figured it out. Okay, great. So now that's out of the way. Hi, everyone. My name is Mahnoor. I'm a senior studying psychology at Stanford.
And my name is Aneeqa. I'm also a senior at Stanford studying human biology.
And today we're presenting on a research study that is part of a bigger community research advocacy project, namely the Stanford Muslim Mental Health Initiative. And this study in particular is aimed at understanding the mental health needs of Muslim college students.
And before we get started, we just want to take a second to thank our team, without whom we would not be able to do this research study. They've helped us from the very beginning of ideating the study to the very end of analyzing the study. And so I just want to give them a shout out. Dania Alalusi, Huma Mandra, April Ball, Dr. Sadia Danani. And we also want to thank our mentors, our community mentor, Dr. Abia Ahmed, and our research mentor, Dr. Rania Awad.
Yeah. And we also want to take a minute to thank the team more broadly. This was definitely a group effort, and we're very grateful for every single person in the lab for bearing with us as we try to see the study through. Also, just a quick note, our team doesn't have any conflicts of interest to report. And with that, let's start with a quick overview of what you can expect from today. So we're going to start with a quick introduction about the research questions, the rationale of why the study came into being. Then we'll go over the study methodology. So what is it that we actually did? We're going to go into findings. So what are some main takeaways? We're going to touch on limitations and then leave you with a few future directions that we think are fitting for the next steps. So let's start with the introduction. First, let's start with how we got into this research study in the first place. Aneeqa and I and a bunch of other research members often talked about the anecdotal evidence that was out there about how Muslim college students seem to be struggling more with mental health concerns. We took to the literature to see if there were any trends we could see, and we found a lot of secondary evidence stating that college students are stressed, we could have told you that, but also that Muslim college students have layers of stress as well that might be more complicated. So after looking at that, we also recognized that COVID-19 had a significant impact on anxieties. There was a survey by the Center for Islam in the Contemporary World that provided that evidence. But overall, something that kept standing out was there was a lack of research on the Muslim students' mental health needs, and especially on how they viewed the services that were available to them. So with all of that in mind, we were also concerned because this meant that if we don't know what their mental health experiences are, their needs might go unmet and unsupported. And so we started the research study with two questions. One, what are Muslim college students' unique mental health struggles, both in relation to their faith and cultural identity? And generally speaking, but also specific to COVID. And secondly, what are their attitudes towards the resources that may be available to them on a college campus? So essentially, we wanted to conduct a study that would give Muslim college students an avenue or the space to voice their needs and bring attention to any challenges that they were experiencing. So let's get into the actual study methodology. We're going to start with a discussion on participant recruitment, go into the demographics for our study, touch on the procedure, so what did we actually do, and then actually show you the protocol questions that we presented to the participants so you can get a feel of what the focus group looked like. So starting with participant recruitment, we advertised the study on 30 different campus-specific mailing lists. We got 64 responses. Out of these, and for these students, we had asked them to partake in focus group discussions and talk about their mental health struggles, their attitudes towards resources, and any needs that they had that they wanted to voice. Then on these 64 students, we applied the eligibility criteria, and we also asked them to fill out or sign a consent form. Once all of that was done, we were left with a sample of 36 participants. So what did the sample look like? To start off, we had a fair amount of representation when we looked at racial and ethnic backgrounds. Around 45% of our sample was South Asian, and another 28% identified as Middle Eastern and North African. We did not have as much representation from white, African American, or East and Southeast Asian identifying individuals, but there were some students from those backgrounds as well. We had an impressive gender divide with an equal number of men and women and 2 people identifying as non-binary. Academically, a majority of our sample was undergraduate students at 61%, but we did have representation from graduate students. And co-term is just a term that's specific to this university, where students that can opt into a master's program while they're still in undergrad and they get counted as something different. So we had a little bit of representation of that. And there was also, we also asked students about how much they said they were religiously or culturally oriented. And around 72% of the sample said they were religiously oriented, and 72% also said that they were culturally oriented. So with that in mind, let's move towards the actual procedure. So we conducted focus group discussions with up to 1 to 5 students. The range was this large because we based it on comfort level. We gave students who preferred one-on-one sessions the opportunity to do so, and some people did avail those. The length of these focus groups ranged from 20 minutes to 2 hours, depending on how many students there were in that session or in that discussion group. We had 5 female facilitators, 4 of whom were Muslim and 1 was non-Muslim, but trained in intergroup facilitation. And students were asked open-ended questions about their struggles, experiences with resources, and unmet needs. And before actually going into the focus group, we created a structured interview protocol using focus group methodology guides, and also getting feedback from the lab about what questions made sense to include and how to rephrase them. After collecting the data, we qualitatively analyzed it to determine important themes and understand what the Muslim students' needs were. We used deduce to do so. And before we actually started the analysis, we ran a test to make sure there was inter-rater reliability, and all the people doing the analysis passed. So now we quickly want to show you what the protocol questions were. Our focus group, so it's almost as if you are in the focus group with us now. The focus group was divided into two sections. First, we talked about challenges, and then we talked about campus resources. For challenges, the first question was, based on your personal experiences and opinions, how do you describe the mental health of Muslim students on campus? Second, we asked them to think a little bit about COVID and had that impacted their mental health and well-being, and if so, how did it do so? Thirdly, we provided them with a scale to rate how much they thought spirituality or religiosity influenced their mental health. And if they said it did influence, or for whatever rating they gave, we gave them the chance to provide reasoning for their response. Also, we allowed them, or we told them that they could give ratings for both how spirituality and religiosity helped or hindered their mental health. And it was interesting because a lot of the participants gave ratings for both. So talked about both how religiosity could help, but also hinder. The second part of the focus group had to do with campus resources. Here we asked them about their experiences with mental health resources on campus. And if they hadn't had experiences, we asked them about their attitudes. Then we used another scale to ask them how well they thought mental health resources on campus were meeting Muslim students' needs. And once again, we asked them to provide a rationale for their answer. And then we ended with asking them that if they could design any mental health resource for Muslim students, what would they want to do? And we told them to think as broadly as they'd like. We said, you have a magic wand, all the money in the world. And so they got really creative for this question.
All right, thank you so much, Mahnoor, for explaining the study aims and how we went through the entire study. Now we'll be going into the findings. Our findings can be divided into 3 categories based on the protocol questions that Mahnoor just outlined. So the first one is mental health challenges. The second one is students' attitudes and experiences with campus resources. And then the last is student recommendations. So we're first going to discuss mental health challenges. What were Muslim students actually struggling with? And the most salient themes that we found were experiences with mental health stigma and awareness about mental health on campus. The second one related to how Muslim students were navigating their unique Muslim identity in a cultural and religious manner on campus. And the last one was the role spirituality and religiosity played in mental health challenges. Yes, that's right. Yeah. So first, to start off, our expectation was that there would be a lot of mental health stigma in the Muslim student community. That was based on our research, and that's what we expected. Well, we actually found that yes, there was some stigma, and that conversations on mental health were uncommon in the Muslim community, but at the same time, there was a lot of mental health awareness on campus as well. We also found that individuals, parents, and family members were often mentioned, and their opinions and views regarding mental health stigma were often mentioned, and we heard, the typical myths about mental health. Mental health is a sign of weakness. Mental health issues are due to a lack of trust in God. Spirituality solves all mental health challenges. And so we heard all of these, prevailing myths about mental health stigma, and how students were mentioning how their families played a role in these attitudes. But we also found that there were also very many open-minded parents who encouraged their children to use mental health resources, and were happy with that. So this graph shows the perceptions of mental health stigma on campus. We see that around over 15% did say that mental health stigma was stigmatized. Slightly more said that it was considered a private matter that they wouldn't really discuss with their families or friends. And so we see that this is kind of a different way of saying that mental health is still stigmatized. And then we see that almost 15% said that they weren't stigmatized. So we see from this that, like the first two bars, that there is still stigma in the community. And then we see an interesting point about the not stigmatized. Those who said that it was not stigmatized, they were often referring to the lack of stigma due to the lack of stigma on college campus in general. So that was interesting finding. And I've also included two quotes here from our focus group that show the different perceptions regarding mental health stigma. So one student was saying that they think it's normalized, mental health is not an issue on campus. They've given khutbas on mental health and heard it, so they think that it's normalized in the community. And another student is mentioning how it's such a difficult personal topic that they don't feel like they can discuss comfortably with others. Our next section is on navigating Muslim identity. So as minority students, Muslim identity plays a big role in the challenges that Muslim students face. And we can see those challenges and we can divide those challenges in out-group challenges and in-group challenges. So out-group challenges include discrimination and microaggressions from non-Muslims, the lack of Muslim representation and Islamic awareness and education in higher ed. Then we can see issues that were internal to the Muslim community that students had, including judgment regarding religiosity levels in the Muslim community, issues surrounding marriage and relationships, especially for graduate students, and students' relationships with families also being a source of struggle. And it's important to note that these were the largest two issues that were related to Muslim identity: lack of representation and discrimination. And this is a quote of one student describing that they have to minimize themselves, minimize their faith, and minimize who they are in order to not stand out as much. Now we're going to go into the role of spirituality and religiosity and the very nuanced role that it played in students' mental health. And before I explain how it both promoted and hindered student mental health, I think it's really important to share that almost every student, as Mahnoor mentioned earlier, mentioned both how mental health promoted, or religiosity and spirituality promoted their mental health, and how it hindered their mental health. So these were some of the ways that students mentioned that it promoted their mental health. It helped them cope with stressors, provided a greater perspective to life, as Humera was mentioning in the earlier presentation. It facilitated mindfulness, it promoted gratitude, provided community. And here's a quote with one person describing how spirituality promoted their mental health, helping them frame the things that happened in their life, provided them greater perspective, and cope with stressors. And this graph shows like the two most significant ways that spirituality promoted mental health. When it comes to spirituality hindering mental health, we found two prevalent themes: faith-related guilt, and students feeling like their own Islamic values conflicted with other prevalent values and worldviews that they had to deal with, such as Western values and liberal secular values, conflicting with their Islamic values, causing stress and mental health. And here's an example of a quote of how one person mentioned how faith-related guilt was hindering their mental health. When they felt like they weren't practicing their spirituality, they would beat themselves over about it. And this graph shows the breakdown of faith-related guilt and conflicting values in our sample. We also interestingly found that many students in our study discussed the negative role that COVID-19 played in their mental health, which is, expected, not very, a profound finding. But what we did find that was kind of very, very profound was that many students also mentioned the positive effects that COVID-19 had on their mental health. And almost every single person who mentioned the positive effects of COVID-19 mentioned them in relation to improved spirituality, being at home and off campus improve spirituality, improving their mental health. Now, now that we've discussed challenges, we're going to go into part 2 of the findings on attitudes and experiences with campus resources, including both positive and negative attitudes and experiences. So we found that students mentioned positive experiences. Like, first, we're going to discuss informal therapy with a Muslim therapist on campus. Students who used this resources appreciated it, and others who didn't use this resource also appreciated it just being there for them. When it came to non-Muslim official campus resources, they were also regarded positively by students in our sample. We also found that other mental health resources were also other campus mental health resources, such as well-being coaches and the student peer counseling network that Mahnoor worked at, were also positively regarded. And we also found that when discussing attitudes and experiences, students were always mentioning resources for the Muslim community being integral to their mental health. So this included the MSA at this university. It included a Muslim community center that was institutionally established and funded. And even some students were mentioning how halal dining accommodations were something that were integral in like promoting their mental health, because it was one less thing that students had to worry about. Now, when it came to negative attitudes and experiences, some students had the opposite attitudes and experiences. So with an informal Muslim therapist, there were mixed opinions. Some were afraid of judgment from a Muslim therapist, while others were happy about this Muslim therapist, but were frustrated that there was a lack of an institutionalized position for a Muslim therapist, and felt that this was just informal therapy that was not sufficient care for them. In regards to official campus therapists, the negative attitudes and experiences included complaints about a lack of Muslim understanding and Islamic awareness, as we mentioned earlier in the Navigating Muslim Identity section. That was something that students were complained about. And another thing was just a general complaint against the lack of availability and care through official campus resources. So now we're going to wrap up our findings by sharing students' personal recommendations for new resources and support for existing resources. So we found that there was a general appreciation for the various mental health services, Muslim community building programming, and specifically programming for marginalized identities within the Muslim community. And then for new resources, students wanted to see more of Muslim-specific mental health community programming to start the conversation on mental health. Students wanted to see clear mental health resource navigation. They didn't know where to start. They didn't know how to access it. They didn't know how. They were confused about insurance and cost transparency concerns. And then for campus therapists, non-Muslim campus therapists, they suggested expanding currently limited sessions, training programs for non-Muslim therapists, and a general increase in diversity of therapists, not necessarily Muslim, but general increase in diversity. And then they also mentioned Muslim-specific mental health resources, including a Muslim identifying therapist, an Islamically and some also mentioned wanting someone who is trained in Islamic psychology or understanding of Islam. And then there was also the concern about a Muslim therapist meeting the needs of students with various levels of religiosity. And this can kind of be broken down in this graphic where 33% of students wanted a Muslim therapist. Some of them were fine with having a non-Muslim therapist or preferred having a non-Muslim therapist. Some thought that a diverse Muslim therapist were necessary. Some preferred a general increase in therapist diversity, and those who wanted a Muslim therapist, there was a portion who wanted Islamic care.
Thank you, Aneeqa. So we've thrown a lot at you, and we're going to wrap up with a few main takeaways that you can leave us with if everything else was a lot. So tying everything together, We're going to leave you with a few main takeaways. But before that, let's quickly revisit the research questions we started with. So one, we were trying to understand Muslim college students' mental health struggles. And two, we were trying to make sense of their attitudes towards psychological services. So did we do that? The main takeaway, some of our main takeaways, number one, there was variance in students' perceptions of the level of mental health stigma. And what was particularly impactful or noticeable was that it seemed like college campuses were a great place for stigma busting, because the students who did say it was not as stigmatized almost always referred to their campus as being like, the general population talks about mental health, and so we kind of also do when we're on campus. So that's a great avenue or thing for us to note, that maybe we should start with college campuses. Two, spirituality and religiosity plays a very nuanced role. It can both help and hinder, and therapists, regardless of how they identify, Muslim or non-Muslim, need to be aware of this. Thirdly, lack of representation and awareness about Islam may not be a very obvious like mental health struggle, but it's the one that came up the most. And so that's something that universities and affiliates and anyone at a campus should know, that doing making sure that there's representation and awareness about Islam could end up helping the mental health of students. Another key point, there is heterogeneity in what students prefer when it comes to a therapist identifying as Muslim. We can't just say that all Muslim students would want a Muslim therapist, because some did not want one. And so there's a need to recognize that heterogeneity. And lastly, mental health support for Muslim students can look like a lot of different things. It can look like increasing diversity on campus resources. It could mean clarifying how to use resources, but also it can mean community programming. Giving students a space to feel like they belong really goes a long way. So now that we've done, it's important to mention some of our limitations as well. Number one, we are aware that we might have had a self-selecting bias when it comes to participant composition. The students that chose to take part in the study on mental health might have slightly lower levels of mental health stigma than the general population, because it shows a higher comfort level with the topic. Second, we might have generalizability concerns, because the study did take place in a top secular liberal US university. Thirdly, there might be a group effect bias. We did have focus groups to allow people to feel more comfortable, but that could have also led to some conforming by the students to maintain face and not be isolated. And lastly, even though we did try to standardize our protocol and standardize analysis procedures and took all these interrelated reliability tests, there is still a layer of subjectivity and qualitative analysis that we are aware of. But even despite this, even after acknowledging these limitations, we do think there is merit in extending research like this, and would like to leave you with a few future directions. Firstly, we think we need a greater generalizability in research. And what that means is we think we need more quantitative studies. So now that we know what kind of themes come up, we can see the creation of surveys that can go out to bigger populations. We would like to see similar studies as the one here, but with other more diverse and representative samples. And also, we are proponents of community research advocacy projects, where you use research to inform initiatives that can then be implemented in the university that you're researching to actually improve outcomes. Essentially, we want to encourage more researchers, and we also want to take part in more translational work, because we see merit in that as well. So with that, thank you all for listening to us. And
Thank you.
Yeah.
Guys, thank you and Jazakallah Khair for a phenomenal and illuminating presentation. If anyone has any questions for these two speakers, we'd request that you write them down on these cards, and we'll hand them over to the discussant, Dr. Preethi Varghese-Joseph, who's an assistant director in the Center for Pre-Professional Programs and an adjunct faculty member in healthcare studies and public health within the College of Health and Human Services at Southern Connecticut State University. She holds medical and public health degrees that are complemented by having lived, studied, and worked abroad in the Sultanate of Oman and India for more than 25 years. She currently serves as chair of the board of directors of Elena's Light, a refugee-led and woman-led nonprofit organization with a mission of educating and empowering refugee and immigrant women. She also serves as the board and secretary and chair of the Health and Safety Committee of the Calvin Hill Daycare Center and Kitty Lussman Finding Kindergarten in New Haven. With that, we'd like to welcome Ms. Preethi Varghese-Joseph to the stage. Thank you. Anyone a card? Would anyone like to write down the questions to the two speakers on the card that we can use later on? So we prefer that you write them down on the card and we'll hand them over to the discussant.
All right. Thank you so much, Zachariah, for the introduction, and good morning to everyone. First of all, I want to thank Humera and Mahnoor and Aneeqa for their fascinating research projects. It's incredible how much can be done, with the resources that you have. And what stood out about these two presentations is it's done in two corners of the world, right? One in the United States and one in Pakistan. And so when I thought about that, I was like, okay, there are so many pros and cons in both situations, considering we're dealing with the Muslim population. So I have some questions for both Humera and Mahnoor and Aneeqa. I don't know if Humera, can you hear us?
You might have to
Unmute Humera.
Yes.
You can hear?
Yes, I can.
All right. Well, I have a question, and I think, Humera, you can go first, and then I'll have the others go in. So my question is, I would like to have you speak on how your study can be generalized beyond the specific context. In the case of Humera's paper, the study was conducted in Pakistan, in a Muslim-dominant country, and your sample size was 10 subjects, right? And in the case of the second paper, the study was carried out in a private elite American university with resources that are not likely to be available in all institutions. I know you've touched on a little bit about this in your presentations, but if you could expand a little bit more, that'd be very helpful. So Humera, you want to go first?
Sure. Okay. Can you please explain a little bit about your question?
All right. So I would like to have you speak on how your study can be generalized beyond your specific context, because your study was conducted in Pakistan, a Muslim-dominated country, and your sample size was 10 subjects.
Yes. Well, it can be generalized on the population of social sciences PhD students, because my research was based on that sample.
Mm-hmm.
And all of the participants were Muslims. And it can be better understood that all those participants reported to have experienced meaning towards life in accordance to their educational experience, in accordance with religion, their social circle, and in accordance with how they perceive, they have the perception about themselves, or the perception about the world or the people around them.
Thank you, Humera. Mahnoor and Aneeqa.
Yeah.
So just to go over your the question again. So in your case, the study was carried out in a private elite American university with resources that are not likely to be available in all institutions. So how would you generalize this to, just about in the United States or even abroad?
Mm-hmm. Yeah, so that was definitely like a concern that we had going into the study as well. And that's why when we had our consent form sent out, we asked all these questions about demographics.
Mm-hmm.
And we did have many students who were based out of the US, but we also had a lot of international students. We had, and we had a large variety of different races and ethnicities that were represented in our sample as well. but we definitely do recognize the need for generalizability. That's why we put it in our future as one of our limitations and in our future directions.
And just one more thing, because this was something that Nika and I spent so many nights like talking about, like how do we increase generalizability. One of the reasons that we really tried to structure our interview protocol and like took so much feedback on it is, yes, like our findings we think are important, but more important is that we want the method to be out in the world, and for others campuses that may not have the resources to have built like a protocol like this to just use ours,
Right.
And like replicate the study in on their campuses and have like their data set and their findings that are specific to them. So this is more of an attempt to like create a bridge and like also show our findings, but also be like, hey, like we created this thing. It worked for us. Hopefully it will work for you too, because that protocol is generalized.
Right, right. I agree with that. Yes.
Yeah. And the amazing thing will be is that like the more this study is done at different universities in the US and abroad, we'll be able to like parse out what are the broader mental health struggles and needs of this population, and what are the more specific needs of each community. And each community will be able to like cater their programming and resources to their.
Right. Great. Thank you. Does anyone have any follow-up questions to that? Oh, in particular to what we were discussing.
Mine is very similar. It's on this paper.
Okay. All right. So what's your name again?
Zainab?
Zainab says, during these studies, have you come across any surveys or assessments specific to the Muslim population? Whenever I think of a potential study, I get overwhelmed about having to create everything from scratch because of a lack of multicultural examples. That's a great question.
And correct me if I'm wrong, I think when we were originally doing our secondary research, and we definitely did not cover like all the search terms out there, so there might be something amazing out there. We did not really come across one that looked at like especially looked at students' attitudes towards existing resources, which was something that we were very interested in. So, but there was like literature on like what are some needs that people think are prevalent, or what are some common, like there were a bunch of lit reviews that were coming up. So we used that finding to create our questions. And so, yeah, we didn't really find a scale that could exactly look like this. But do you remember anything?
Yeah, so no, when we were starting off, we felt that we didn't find everything, but we're actually in the process of doing a literature review with the Stanford Muslim Mental Health on everything that is out there on Muslim student mental health, covering like all the different search terms, all the different databases, so we can really figure out what's out there. And while we haven't, published the results yet, we still don't think that there is much out there in this field.
I would love to collaborate on that if you guys are open to it. Ever since I started my graduate program the past 2 years, I've been specifically researching Muslim college students, especially Muslim American college students and Muslim college students, but there's not much out there in that world. So I really, really appreciate the time that you guys said that we created this method to be out there, because I was my presentation is specifically on Muslim college students' mental health needs, but mine is a proposed research study because nothing like this was out there when I found it. So it seems like this is just such good news to me, because you guys are creating the stuff that I've been desperately searching for. And as you said, once it's out there, hopefully more people replicate the study and add to it and collaborate, so that the people coming after us won't have to get overwhelmed to create anything from scratch, right?
Great. All right. I just wanted to, proceed with some more questions. So Humera, I have another one for you. And one of the questions as you went along was, you mentioned participants were approached in your study. So I was just wondering if this was not open to everyone. Was this just limited to a particular university, or was this, broader across, universities in Pakistan? And why just postdoctoral students?
Okay, so our study consisted of PhD students. Sorry. The study was on a broad perspective. Like we took participants from government universities as well as from private universities. There were a total of 6 universities from where we took the participants. And the PhD students, the population which I took was basically, there was a literature gap in the study that was done. There was not much indigenous researches that incorporated the concept of meaning in life on PhD students. When I was doing my research and I came across with articles related to meaning in life, there were some articles, researches done abroad related to meaning in life on the population of undergraduate students. On yeah, so that's why I chose postdoctoral students. Yeah.
Does anyone have any follow-up to that? Okay, thank you. Oh, okay. What's your name?
Amelia.
Amelia has a question.
Yeah, sure.
Humera, what initially drew you to this research question? What sparked your curiosity to explore this?
Well, basically, it was my personal interest because meaning in life is a broader concept, and not much research has been done on this concept yet. And that's why I chose this topic.
Thank you.
Thank you. All right. I have a quick question again for you both. So you talked about resource, and I like that that was one of your research questions, right? You know, what kind of resources would you want, you know, on your campuses? So that said, how might campus resources differ across campuses? For example, resources might be more specialized at a less elite university, and I'm even just fascinated that you have a Muslim mental health. You know, do you have a, it's a psychology lab, or do you have a community? Do you have some?
So we are actually fortunate to have both, and they're separate. So we have a Muslim mental health and Islamic psychology lab in the psychiatry department, led by Dr. Aneeqa Abid, who's right there.
Okay.
And then we have a community center that's part of the university's funding and structure, and that's for yeah, that's
Okay. So to go further, the question is, for example, because you have a more, you know, elite university would have more resources. So for instance, in our backyard, we have University of New Haven. It's a smaller university, private university, annual budget about with a smaller annual budget and about 7,000 students, but they have a predominantly Muslim student population on campus. And compared to Yale University with about 13,000 students and an annual budget of more than 4 billion, right? So their resources are vastly different. So, you know, do you have ideas, or from what you've done, have you gotten ideas about how you can replicate these kind of, you know, resources across campuses, no matter, you know, what their annual budget is?
So this is kind of why it's really important to have this study be replicated in other, and not just the research aspect, but both the research and community aspect of it conducted in all of these different communities. Some colleges may not even have a university like Muslim chaplain, and that may be like very, very important, maybe like a very, very important first step. Some may not even have like maybe MSAs. Some may not even have like, you know, like many probably don't have an institutionalized Muslim community center like our university did.
Right.
But by seeing our results and seeing how beneficial these resources were, students will, like, who want to, you know, initiate these studies and other places will know that, and will also be able to create resources that are more, like, advocate for institutionalized resources that are more specific to their communities, and also kind of share how impactful and beneficial they were using our research and like, our findings.
Yes, I like that. That's very nice. So I have some more questions, and before we run out of time, I'll just go through that. So this is for Dr. Humera. What was the rationale for the exclusion criteria in the study? I had the same question. Who asked that question?
Yeah. Rationale for the exclusion criteria?
Exclusion criteria.
Yes, the participants who have submitted their work for peer review were excluded, and the participants who were getting scholarships or finance from higher education, they were excluded because of the reason that the participants who have submitted their work for peer review are towards the end of their PhD program. Basically, our participants were supposed to be who are at the initial stage of PhD or in the middle stage of the PhD. That's why we choose the exclusion criteria, because at the initial stage of PhD, I have seen many PhD scholars myself. They're really stressed out. They are really, really stressed out at that time because they have a lot to do. They have a lot to a lot to come in their ways. So that's why we took those participants who were in their initial phase of PhD rather than those who have submitted their work for peer review. Also, the second exclusion criteria that we chose was participants who were receiving financing from Higher Education Commission. If they have financial support from any other source, their meaning of life would not be hindered as much as the ones who are on self-finance, who are supporting their own self. That's why these two exclusion criteria were included.
Mhm.
Yeah.
Thank you.
Yeah.
Okay. So we have another question from Mahnoor and Aneeqa. What role would race play in the variance of struggles towards Muslim health? What efforts were taken to achieve the Muslim Black voice representation?
That's a great question. Race did come up in a few of the focus groups. Unfortunately, like you stated, there was representation of African or African American students, but not as much as we would have hoped or liked. So ideally, we would have wanted a greater representation, but we did have a few students who, in the focus groups, often brought up. One thing that came up a lot was like having to navigate different identities and how like being a proud Black woman, I'm like thinking of one particular case, and also being a proud Muslim woman, like and how doing both at the same time could be challenging. And so we do have anecdotal accounts for that, but we definitely want, like if we do a follow-up or more studies, we want greater representation. Specific to that, a few individuals talked about how they wanted programming, where we also have a Black community center on campus, or how they wanted like more across like the Muslim community center and the Black community center, mental health or other community events that brought both communities in, so that there were more specialized events for different groups within the broader like Muslim diaspora.
Right, that's excellent.
And to add on to that, there were also accounts of students saying that they like one student talked about their experiences with a Black therapist with the official campus resources, and mentioned how they would have preferred to have a Black Muslim therapist. And so we kind of took from that, if you remember, like one of our last slides, which was a Venn diagram showing the different types of preferences that students had, that would kind of be both a need for a Muslim therapist and also a need for greater diversity.
Right.
So that's kind of some of the findings.
Yeah, I thought that's a great response. That was my question. I really appreciate it. I think also one of the limitations is just you have a limited sample to draw from, because at these institutions, which are predominantly white institutions, it's difficult to recruit participants from more marginalized backgrounds, even within our own community marginalized. So I think that when we conduct studies like this, there should be an intentional effort on the front hand, like to try and over sample or try and weight it a little bit.
Yeah, and we did try to do that a little bit. We definitely need to do it more, but of the 30 mailing lists that we mentioned, some were specifically for Black students, and so we would often like send more like listings there, and that's where we got a lot of the students from, and not just general mailing lists, but we definitely like recognize that concern as well and try to oversample. Like I said, we could have done more. Yeah.
Yeah, no, and it's to no fault of your own too, because I think also some of the subgroup populations, they also require unique methods of recruitment. So like whereas an email list might work for some groups, like in-person events work for other groups. And then, there's a lot of, you just kind of have to know your crowd a little bit, but yeah, you're working against the odds. Really.
Right. And that would lead again to the next phase of your research, right? More work to be done. All right. So there is another question for you both. What was the most surprising finding that you least expected? I think I should also post that to Humera after you guys go.
Yeah. I think for me, the most surprising thing was how COVID-19 really improved students' spirituality. And I think like from that, I got that perhaps students, when they were not on campus, when they were at their own homes, they were like their spirituality was improved, and their mental health was improved. And so like from that, I took that like perhaps there's something about this university that is making it so that spirituality is not promoting their mental health as much as when they're away from when they're in their homes and families, when they are able to like connect with their faith. Yeah, because there's so many barriers on a college campus, like the lack of like Muslim representation, having to deal with being a minority like every single moment of being a student, and like you have so many other challenges, and just being a Muslim is like so difficult. You're not even able, maybe you're struggling with dealing, and not only being a Muslim, being a student is so stressful that you're not able to connect to your spirituality as much, and you're not able to have it be something that can improve your mental health. And I think that that's something that I want to share with like the institution, that like your students' spirituality improves their mental health when they're not on your campus.
Okay.
When they're students, but when they're not on your campus. And so I think
So to that, I want to ask, so your participants, were they all boarding, like they were residents at college? Okay, so they were not commuters. Okay, so I had just because I had, one of the questions I had written down was, this is just looking at it a different way. Did COVID improve spirituality and mental health because of the extent of disruption of life and what the pandemic did to us in general, and this feeling of hopelessness? I think most of us felt that at some point, especially during the lockdowns, and they sought faith more so now than before. And I think a lot of us can speak to that, because I think that goes hand in hand. When one is distraught and downtrodden or hopeless, you seek out something much larger than you, right? So that was the way I thought about it.
Yeah.
I think, Zainab, you had something.
I was just gonna say, on the complete opposite end of that, when you shared about how, like the campus being a danger zone for spirituality, that kind of made me realize, like, maybe it wasn't a me problem. Maybe it wasn't my sister's problem or my brother's problem, that, because I feel like there's something about college campuses that make you feel like your iman is weak, right? So it seems like maybe it's a system problem rather than a me problem, because I think, especially with faith-based guilt being so high on your findings, that something about college campuses take away from our spirituality, but then that leads to a very dangerous trap of feeling guilty and then stepping a little farther away and then feeling more guilty. So maybe if we're to conduct more studies about this issue, it can help so many more college students to feel that they're not alone in this struggle, right? And maybe it's not a them problem, it's less than that guilt, to foster spirituality?
I have one last question.
It's a comment on what you guys are discussing.
Okay.
So I actually went to college at UT, and we have an on-campus class. And going back to like the generalized community, it'd be interesting to see how it's played out at like our community or like in our university. Because for us, like spirituality actually like post-COVID and such, or like during COVID, mainly because a lot of the students, like for us, going to the mosque was like a daily activity of like like integrated into the community. Like people would just be there casually, people would be there to pray. Like if you weren't in classes, that's for many of them was regardless of like how much people was practicing necessarily. But for a lot of us, like spirituality actually once COVID went.
I would say that that's because UT's doing a better job at making sure that spirituality is like an important part. It's like,
It'd be interesting to see how it played out. It's like a lot of our students have the same reservations with Muslim therapists on campus, or the lack of Muslim therapists that like the university provides, as well as like the lack of cultural competency that they have on campus therapists. Like they just assume you don't drink, you don't do every drug, if you walk in, say you're Muslim, and if that's the problem you're coming in for, obviously that's a deterrent.
Yeah.
Very much so.
Definitely. But yeah, just to like, these were all incredible points, and these were all exactly the thoughts we were having, because we also, so the finding about COVID facilitating spirituality, like Aneeqa definitely got a lot of like what the participants were saying, but some are also citing stuff that you mentioned, like, oh, I had more time, and like I was just like more free. And so a lot of students talked about how amazing Ramadan was that first time, and I will also say it was much better than my other fasts because I just had more time. And so definitely it's like not just one, there were multiple factors that were leading to the facility.
Yeah, and I just forgot, I wanted to pose the same question to Humera as to what was the most surprising finding that you least expected, Humera, in your study?
Yes, the most surprising results were that participants reported that their traumatic life experiences facilitated their meaning in life, which is the hardships, anything that brings them suffering was contributing to the meaning in life, helping them seeing life in a more positive way.
Right.
That was one of the surprising things. Also, I would like to add that during the COVID-19 times, though it was a tough time, but those times were beneficial for some people, as they got the time to self-reflection, self-acceptance. And as in the current times, the life is fast-paced. COVID-19 happened to be a break at that time for everyone.
Right.
Yeah.
Well, thank you so much. I think I need to wrap up the question session. Thank you so much to the participants and for all your wonderful questions. And thank you again for allowing me to be part of this panel. Thank you again.
Meeting.